Have you ever swung your legs out of bed this morning and felt that moment of panic when they seemed weaker than they should be? Maybe you stood up from your favorite chair and noticed you had to push off with your arms more than usual, or perhaps you've started avoiding stairs because your legs just don't feel as strong as they used to. If any of this sounds familiar, I need you to listen very carefully to what I'm about to share with you. What you're experiencing isn't just normal aging. It's the result of 5 everyday habits that are silently destroying your leg muscles after 60, robbing you of the strength and independence you've worked your whole life to maintain. Here's a terrifying truth that most seniors don't know. You can lose up to 8% of your muscle mass every single decade after age 30. But certain habits that seem completely harmless can accelerate this muscle loss so dramatically that you could lose the ability to live independently within just a few years. 5 seemingly innocent daily habits are acting like silent assassins, eating away at your leg muscles while you sleep, while you sit, while you go about your normal routine. These habits are so common that millions of seniors do them every single day without realizing they're stealing their mobility, their balance, and ultimately their freedom. But here's the hopeful news. Every single one of these muscle-destroying habits can be reversed. We're talking about changes you can make starting today that could restore strength to your legs, improve your balance, and give you back the confidence to climb stairs, walk distances, and maintain the independent life you deserve. Before we dive in, this is educational information based on peer-reviewed research, not personal medical advice. Please consult with your doctor before making changes to your routine, especially if you have heart conditions, diabetes, joint problems, or take medications that might affect your exercise capacity. Today, we're counting down the 5 most dangerous habits for leg muscle health in seniors, starting with number 5 and building to the most shocking one at number 1. Let's start with habit number 5. Habit number 5, prolonged daily sitting without movement breaks. When you sit for more than 30 minutes at a time, you literally turn off the muscle-building signals in your legs. It's like flipping a switch that tells your muscles to start breaking down instead of building up. When you sit for extended periods, your glute muscles essentially go to sleep. Researchers call this gluteal amnesia, and it means your body forgets how to activate these crucial muscles even when you need them most. Prolonged sitting reduces blood flow to your leg muscles by up to 90%. Think of your muscles like a garden that needs constant water and nutrients to thrive. When you sit for hours, you're putting your muscle garden into drought conditions. Sitting also triggers the release of inflammatory chemicals that actually dissolve muscle protein. It's like having tiny rust monsters eating away at your muscle fibers while you watch television or read the newspaper. Most seniors vastly underestimate how much they actually sit. You might think you're active because you take a walk in the morning, but if you're sitting for 8 to 10 hours throughout the rest of the day, you're still in the danger zone for rapid muscle loss. Here's a shocking fact. Sitting for just 2 hours straight can reduce your leg muscle protein synthesis by 50%. That means half of your muscle-building capacity is shut down just from sitting in your favorite chair for 2 hours. Robert, a 72-year-old retired teacher, loved to read. He would settle into his recliner after breakfast and often wouldn't get up until lunch, then return to reading until dinner. Robert noticed his legs feeling weaker, but he blamed it on aging. When he started setting a timer to stand and walk around his house for 2 minutes every 30 minutes, something remarkable happened. Within 6 weeks, he could get out of his chair without using his arms for the first time in 2 years. Your muscle-saving swap is simple. Set a timer for every 30 minutes and stand up for at least 2 minutes. You don't need to do jumping jacks. Simply standing up activates your leg muscles and restores blood flow. Walk to the kitchen for a glass of water. Step outside to check the mail, or just stand and stretch gently. Think of your muscles like employees. If you don't give them any work to do for hours at a time, they start to think they're not needed anymore and begin to quit. But when you stand up regularly, you're giving your muscles a gentle reminder that they're still important. Have you noticed your legs feeling stiff or weak after sitting for long periods? That's your muscles crying out for movement. Habit number 4, inadequate protein intake, especially in the morning. Most seniors are shocked to learn that their protein needs actually increase after age 60, not decrease. Your muscles become less efficient at using protein as you age, which means you need more of it to maintain the same muscle mass. When you don't eat enough protein, your body starts breaking down your existing muscle tissue to get the amino acids it needs for essential functions. It's like your body is cannibalizing your leg muscles to keep your heart, brain, and other vital organs functioning. The morning protein gap is particularly devastating for seniors. After sleeping for 8 hours without eating, your muscles are already in a breakdown state. If your breakfast is just toast and coffee or cereal with milk, you're not providing enough protein to switch your muscles back into building mode. Most seniors need at least 25 to 30 grams of protein at each meal to stimulate muscle protein synthesis. But the average senior breakfast contains only 8 to 12 grams of protein. That's like trying to fill up your car's gas tank with just a few drops of fuel. The portion trap hits when seniors think they're eating enough protein because they have meat with dinner. But spreading your protein throughout the day is crucial. Your muscles can't store amino acids like your body stores fat or carbohydrates. If you eat 60 grams of protein at dinner but only 8 grams at breakfast, your muscles are starving for the first 2/3 of your day. Seniors who eat less than 20 grams of protein at breakfast lose muscle mass twice as fast as those who eat 25 grams or more. That morning protein is like flipping the switch from muscle breakdown to muscle building for your entire day. Margaret is a 69-year-old grandmother who prided herself on eating healthy. Lots of fruits and vegetables, whole grains, very little meat because she thought it was better for her health. But Margaret started having trouble getting up from her grandchildren's low chairs during visits. Her legs would shake when she climbed the stairs to their bedrooms. When Margaret started eating 2 eggs with her morning oatmeal and adding Greek yogurt to her lunch, her leg strength improved dramatically within 8 weeks. She could play on the floor with her grandchildren again and climb their stairs without holding the railing. Your muscle-building swap. Aim for 25 to 30 grams of protein within 2 hours of waking up. 2 eggs plus Greek yogurt gives you about 26 grams. A protein smoothie with protein powder, milk, and berries can easily provide 30 grams. Even adding a handful of nuts to your oatmeal and using milk instead of water can boost your morning protein significantly. Your palm is roughly equivalent to 20 to 25 grams of protein. Use this visual guide to ensure you're getting adequate protein at each meal. Your muscles are literally rebuilt from the protein you eat, so don't let them starve. Habit number 3, chronic low-level inflammation from poor sleep and stress. Poor sleep quality triggers the release of inflammatory chemicals called cytokines that literally eat away at your muscle tissue while you rest. When you don't get deep, restorative sleep, your body releases stress hormones like cortisol that break down muscle protein to convert it into glucose for emergency energy. It's like your body thinks you're in survival mode and starts consuming your muscles for fuel. Poor sleep also reduces growth hormone production by up to 70%. and growth hormone is essential for muscle repair and maintenance. Chronic stress compounds this problem by keeping cortisol levels elevated throughout the day. High cortisol acts like acid on your muscles, dissolving the protein structures that give them strength and size. Many seniors accept poor sleep as normal aging and don't realize the devastating impact it's having on their muscles. They might think they're sleeping enough because they're in bed for 8 hours, but if they're waking up frequently, not reaching deep sleep stages, or feeling tired during the day, their muscles are paying the price. Seniors who sleep less than 6 hours per night lose muscle mass 30% faster than those who get 7 to 8 hours of quality sleep. Sleep isn't just rest. It's when your muscles do most of their repair and growth work. The stress connection is equally important. Chronic worry about health, finances, or family creates a constant inflammatory state in your body. This inflammation specifically targets muscle tissue, breaking it down faster than your body can rebuild it. Dorothy, a 74-year-old widow, was struggling with anxiety and insomnia after her husband's passing. She noticed her legs becoming progressively weaker and was starting to worry about falls. Dorothy was barely sleeping 4 hours per night and spent most days worrying about her future. When she started a simple bedtime routine, no screens after 8 p.m., chamomile tea, and gentle stretching, her sleep improved to 6 to 7 hours per night. She also joined a grief support group that helped her manage her stress. Within 10 weeks, Dorothy's leg strength had improved so dramatically that she felt confident walking to the grocery store again. Your muscle-protecting sleep swap. Create a consistent bedtime routine that signals to your body, it's time to rest and repair. Keep your bedroom cool and dark, avoid caffeine after 2 p.m., and try gentle stretching or meditation before bed. For stress management, consider activities like gentle yoga, deep breathing exercises, or social connections that bring you joy and peace. If you wake up feeling tired even after 7 to 8 hours in bed, talk to your doctor about sleep quality issues. Sleep apnea is common in seniors and can severely impact muscle health. Think of sleep as muscle medicine. Every hour of deep sleep is like sending a repair crew to work on your muscles, fixing damage from the day and building them back stronger. Habit number 2, avoiding challenging activities that require leg strength. Many seniors, worried about falling or getting injured, start avoiding activities that challenge their leg muscles. They stop climbing stairs when elevators are available, avoid walking on uneven surfaces, and give up activities like gardening or dancing that require balance and leg strength. Your muscles operate on a simple principle. They adapt to the demands you place on them. When you consistently avoid challenging your leg muscles, you're essentially telling your body that strong legs aren't necessary anymore. Your body starts redirecting resources away from maintaining muscle tissue you don't seem to need. This creates a vicious cycle. As your muscles weaken from lack of challenge, activities that used to be easy become harder. This makes you avoid them even more, which weakens your muscles further. Before you know it, simple tasks like getting out of a car or stepping up onto a curb become genuinely difficult. The challenge avoidance trap is particularly dangerous because it feels like you're being smart and careful. But there's a crucial difference between being recklessly unsafe and appropriately challenging your muscles. Seniors who avoid stairs and always use elevators lose leg strength 40% faster than those who climb stairs regularly, even just a few steps at a time. Your muscles literally forget how to generate the power needed for stair climbing when you stop doing it regularly. When you always walk on flat, even surfaces, and avoid any situation that might test your balance, your muscles lose their ability to make quick, stabilizing adjustments. This actually increases your fall risk rather than decreasing it. Harold is a 78-year-old retired mechanic who became increasingly cautious after a minor stumble in his garage 2 years ago. He started avoiding his basement workshop, stopped working in his garden, and even had his groceries delivered. Harold's wife noticed his legs becoming visibly thinner and weaker. When Harold started a simple routine of climbing just 5 stairs twice a day and standing on one foot for 10 seconds while brushing his teeth, his confidence and strength began returning. Within 3 months, Harold was back in his workshop and had resumed grocery shopping. Your muscle-strengthening swap. Gradually reintroduce appropriate challenges for your leg muscles. Start with simple activities like standing up from a chair without using your hands, taking the stairs for just one flight instead of the elevator, or standing on one foot while doing daily tasks like brushing teeth or washing dishes. The goal isn't to become an athlete overnight. It's to maintain and gradually improve the muscle strength and coordination you need for daily independence. Even small challenges, done consistently, can prevent dramatic muscle loss. And now, the #1 most dangerous habit for leg muscle health in seniors: medication-induced muscle loss that goes unrecognized and unaddressed. This is the silent killer of leg muscles that virtually no one talks about, but it affects millions of seniors every single day. Certain medications commonly prescribed after age 60 can directly cause muscle weakness, muscle wasting, and coordination problems that make your legs feel unreliable and weak. Statins prescribed to millions of seniors for cholesterol management can cause muscle pain, weakness, and in severe cases, actual muscle breakdown. But the muscle weakness often develops so gradually that both patients and doctors attribute it to normal aging rather than medication side effects. Blood pressure medications, particularly diuretics, can cause electrolyte imbalances that directly affect muscle function. When your potassium, magnesium, or sodium levels are off, your muscles can't contract properly, leading to weakness, cramping, and coordination problems. Proton pump inhibitors, commonly prescribed for acid reflux, can interfere with the absorption of crucial nutrients like vitamin B12, magnesium, and calcium that your muscles need to function properly. Long-term use can literally starve your muscles of essential nutrients even if you're eating a healthy diet. Some medications prescribed for anxiety or sleep problems can affect the nerve signals that control muscle activation. Your brain might be telling your legs to move, but the medication interferes with that signal. Seniors taking 5 or more medications have double the risk of muscle weakness and falls compared to those taking fewer medications. But many seniors don't realize that their leg weakness could be related to their medications. Elizabeth, a 71-year-old former nurse, was taking medications for cholesterol, blood pressure, acid reflux, and occasional anxiety. Over the course of a year, Elizabeth noticed her legs becoming progressively weaker. She had trouble getting out of low chairs, her legs would shake during longer walks, and she felt unsteady on her feet. When Elizabeth worked with a pharmacist to review all her medications, they discovered that the combination was likely contributing to her muscle weakness. By switching to different formulations and adjusting dosages under medical supervision, Elizabeth's leg strength improved dramatically within 8 weeks. Your muscle-protecting medication swap. Have a comprehensive medication review with your doctor or pharmacist at least once a year. Ask specifically about muscle-related side effects and whether any of your medications could be contributing to weakness or balance problems. Keep a simple diary noting how your leg strength and energy feel in relation to when you take your medications. If you notice patterns, share this information with your healthcare team. Now, let me give you 3 powerful habits you can start implementing this week to begin rebuilding your leg strength. First, practice the chair stand challenge every morning. Before you have your first cup of coffee, practice standing up from a chair without using your hands 5 times in a row. This activates your glute muscles, strengthens your thighs, and reminds your nervous system how to coordinate these crucial movements. Second, add protein timing to your daily routine. Eat at least 20 grams of protein within 2 hours of waking up, then aim for protein at every meal. Your muscles need consistent protein throughout the day to maintain themselves. Third, implement movement snacks throughout your day. Every hour, do something that challenges your legs for just 2 minutes. Stand up and sit down a few times, walk to another room, step in place, or do gentle calf raises while holding onto a counter. Let me recap these 5 muscle-destroying habits. Number 5. Prolonged sitting without movement breaks turns off your muscle-building signals. Set a timer for every 30 minutes and stand for at least 2 minutes. Number 4. Inadequate protein intake forces your body to cannibalize your existing muscle. Aim for 25 to 30 grams of protein at breakfast and throughout the day. Number 3. Poor sleep and chronic stress release muscle-dissolving hormones while reducing growth hormone production. Prioritize 7 to 8 hours of quality sleep and stress management. Number 2. Avoiding challenging activities teaches your body that strong muscles aren't necessary. Gradually reintroduce appropriate challenges like stairs and balance tasks. Number 1. Medication-induced muscle loss often goes unrecognized. Have regular medication reviews with your healthcare provider. Your legs have carried you through every important moment of your life. They've been faithful servants, and now it's time to serve them back. These 5 habits can be changed starting today. You don't need expensive equipment or dramatic lifestyle overhauls. Small, consistent changes can literally give you back years of strength and independence. Remember, muscle loss isn't inevitable. Your muscles are remarkably adaptable even at 70, 80, or 90 years old. They're waiting for the right signals to start growing stronger again. Which of these habits surprised you the most? Comment below. Sitting. If you sit too much, protein if you need to eat more protein. Sleep. If sleep quality is your biggest challenge, challenge. If you've been avoiding activities that strengthen your legs, or MEDS, if you want to review your medications. If this information opened your eyes to how these everyday habits affect your leg strength, please share it with another senior in your life. Subscribe for more senior health tips that could help you stay strong, mobile, and independent. Your legs have been faithful to you. Now it's time to be faithful to them. Start with just one change today.